So welcome back. We're going to pick up the discussion with the topic vitamin C deficiency. So of course a really severe deficiency in vitamin C leads to scurvy. And there's not a lot of scurvy around these days, but some of the early stages of vitamin C deficiency I think are common in our society. We'll talk about that. But just to paint the picture, if a person stopped ingesting vitamin C completely, that within 30 days the person now is going to develop the initial signs of scurvy. So you don't store a lot of vitamin C in your body. As soon as your body pool level drops below 300 milligrams, you'll start to get some of the scurvy-like onset features that we'll talk about. The normal body pool is 1,500 milligrams of vitamin C. So the groups who are most inclined to develop a vitamin C deficiency are alcoholics, because they wash it out. It's a very unstable compound. Their diets usually are not good, and the elderly as well. And what's interesting is that the Inuit people who live, up north, sometimes are existing on almost no plant foods where you would find vitamin C. But there's a little bit of vitamin C sometimes in fish, just stored as, as small amounts. And it's because they're eating a lot of these foods after they've been frozen or raw. Cooking destroys vitamin C. So if you don't destroy that little bit of vitamin C that's in there, some groups seem to be able to prevent a vitamin C deficiency having no plant foods, which is really remarkable. But it's important to know that vitamin C is the least stable of all the vitamins. It becomes oxidized very readily and degraded, when it's heated or exposed to light or air, or it's in an alkaline solution. But heating foods, cooking them to high temperatures, exposure to ultraviolet light and sunlight can destroy the vitamin C in food very easily. So scurvy is preventable just with 10 milligrams of vitamin C a day. That's not the optimal amount of vitamin C you'd want someone to take in each day from food and or supplements, but all you need is 10 milligrams of vitamin C to prevent the disease. The earliest sign of a vitamin C deficiency, weakness and lassitude. And then you start moving towards the early sort of scurvy-like symptoms. Because vitamin C supports collagen in the basement membrane, right? As soon as the basement membrane of blood cells starts to weaken, then blood can sort of leak through the vessels, and on the skin you see these little red dots, petechial hemorrhage, or brown dots sometimes. And then the skin cells become a bit abnormal, and you get perifollicular hyperkeratosis, small little bumps on the skin. That it's not an uncommon thing to find. Now, it's not always vitamin C deficiency that causes that. It can also be vitamin A and omega-3 fats, other factors. And but a little bit of bleeding into the skin, purpura, this would be a little more advanced. And then you look at the other symptoms, where you start having major joint and muscle and tissue breakdown, and you start to get very serious symptoms as the thing progresses. So severe scurvy results in tooth loss and bone damage, internal hemorrhage and infection. It's fatal if it continues to a significant degree. And the diagnosis usually involves clinical findings to a greater degree than just low blood vitamin C levels, because it's really the overall tissue storage of vitamin C that's producing the clinical signs and symptoms. So it's sort of you have to put a matrix of things together to really appreciate if the person has a vitamin C deficiency. Sometimes just looking at their blood levels is not the indicator that would say there's early stage problems. Treatment is 100 milligrams 3 times a day until you have reached a stable blood level. So you don't really need that much to actually bring the blood levels back up. But of course, many of us take in vitamin C each day well beyond 300 milligrams a day, and there's reasons to consider doing that. We'll look at that. And so let's go here. Let's look at the supplementation studies that give us some other clues as to what vitamin C can do when it's used therapeutically. So there's a condition in the stomach, a precancerous condition called gastric dysplasia. I think it's sometimes called atrophic gastritis of the stomach. And a couple of clinical studies have shown that 1,000 milligrams a day of vitamin C twice daily, 1,000 milligrams twice daily, has reversed the precancerous state back to normal. So vitamin C obviously plays a role in cellular differentiation and improving the morphology of the cell structure. Vitamin C, because it's ascorbic acid, The acidity enhances the absorption of iron, and we think even some other positive cation minerals. But for iron absorption, it's important. A lot of people have low iron. This is a common finding, of course, in women of childbearing age and other populations where they're losing a lot of iron, menstrual flow and so on, or people are not ingesting enough because of their dietary behaviors. But low serum ferritin is not an uncommon finding. So vitamin C can help to enhance iron absorption from the gut. And people with asthma have benefited from vitamin C supplementation using 1,000 to 2,000 milligrams a day. And what it's done, vitamin C at higher doses has an antihistamine-like effect, reducing some inflammatory chemicals in the lung tissue, but also helping to prevent lung damage from nitrogen oxide, which is a common dangerous element in air pollution and in cigarette smoke. So we think through those couple of mechanisms, vitamin C may be helpful in asthmatics according to the early clinical trials that we have. But there have been 11 of these studies done to date to look at this, so there's not just one or two studies. Then vitamin C in preventing the recurrence of cancer. So the very first study that used human subjects to examine this was in the molecular aspects of medicine back in the early 1990s. It was Folkers and Lockwood who did this study. They took women who had already had breast cancer, 32 women who had breast cancer that had already spread to the axillary lymph nodes. So that means it's a highly malignant cancer. They underwent medical treatment. And then when the treatment was over, they took this subgroup of 32 women and they put them on a supplementation cocktail based on the experimental evidence that said certain supplements seem to have anti-cancer properties. So if we give them to someone who's already had a cancer, and because it's been spread to the axillary lymph nodes, we know even when we treat those women that over the next 2 or 3 years, a lot of those cancers will still show up again somewhere else in the liver and the bone. There'll be progression, there'll be other problems. We know that once it spreads to the axillary lymph nodes, there's a high risk of recurrence, even if we treat this person. So they took this subgroup of women and put them on this supplement cocktail of high dose vitamin E and selenium and coenzyme Q10 and beta carotene. But in that cocktail was 2,850 milligrams of vitamin C each day. And they showed, and they had a multiple vitamin and some essential fatty acids as well. So it was quite a cocktail. But what they showed is that none of the women in this trial, after a year and then after 2 years, had any further progression of their cancer. There was no cancer recurrence. They reported very high quality of life standards on their index, and they had no untoward side effects. So this was the very first study that was published in a peer-reviewed clinical journal showing that supplementation may be able to prevent the recurrence of cancer. There have been other studies since then, but this one included vitamin C. Some integrative cancer doctors and some naturopaths that are licensed to do this use vitamin C sometimes intravenously to help with integrative cancer treatment. So it may not be the only course of action, but it's one of the additional measures you can add in some cases. So to understand it, when you give vitamin C at a dose of 50 grams, or that's 50,000 milligrams, you couldn't take that orally. There'd be an absorption limiting effect. You just couldn't get that much to cross into the bloodstream. That has to go in intravenously. But up to 50 grams a dose infused over time increases immune system activity. You'd like to get the immune system back into the fight, so the macrophages, the dendritic cells, the beta lymphocytes could find cancer cells and ingest them and then bring them back to the immune system, get the CD4 cells to recruit to launch an attack and get the other immune cells into the fight, cover them with antibodies, get the natural killer cells, more aggressively trying to kill those tumor cells. So anything you can do in terms of immune modulation in cancer treatment is usually a good thing if you can upregulate the immune system. So up to 50 grams of vitamin C does that. Beyond 50 grams a day, vitamin C starts to act like a free radical generating machine. So because vitamin C looks a lot like glucose, and cancer cells, for the most part, can only use glucose as a source of energy. It's one of the unique features of cancer cells, that they don't like to use fats or ketones or other things. They use glucose as a source of energy. Now remember, they can also take in glutamine, the amino acid glutamine, and convert it into alpha-ketoglutarate and then to oxaloacetate, and it can backpedal to glucose, so it's gluconeogenic. So they can use glutamine that way. But they want glucose if they can get it. And glucose and vitamin C look very similar. So as the vitamin C goes by the cancer cell, they'll take a lot of the vitamin C in. And when they do, that high dose of vitamin C interacting with iron and copper and other metals inside the cell generates tons of free radicals. And unlike normal cells in the body, cancer cells don't have a lot of antioxidant enzymes. They don't make very much catalase and superoxide dismutase. They can't mitigate the damage from the free radicals. So this high free radical concentration in the cancer cell sort of kills the cancer cell, induces apoptosis, programmed cell death, or blows them up, and the cancer cells die. So vitamin C at high doses, above 50 grams a day, especially when it's coupled with vitamin K3, has been shown in some studies to act as sort of a very inexpensive form of a generalized chemotherapy that really has very few potential side effects. So it is used that way. Some studies show that vitamin C can slow down the formation of cataracts. And this is because vitamin C can act on the lens of the eye as an antioxidant. So remember, as ultraviolet light is shining through the lens of the eye and getting to the back of the eye to stimulate the optic nerve for vision, that ultraviolet light, the same way it can do free radical damage to our skin and cause skin damage, photoaging, skin cancer, that the ultraviolet light can generate free radicals in the lens of the eye. Vitamin C as an antioxidant in that role seems to be able to minimize the free radical damage in the lens, decreasing risk of cataracts. And also, high doses of vitamin C seem to be able to inhibit this enzyme known as aldose reductase, which stops the conversion now of glucose into sorbitol in the lens of the eye. When you have a lot of sorbitol in the lens of the eye, you get chemical reactions that lead to opacities that actually produce cataracts. So in diabetics who have high blood sugar, a lot of the glucose, and some of it, there's a greater likelihood it'll get in this part of the eye, and aldose reductase converts it into sorbitol, and then the sorbitol concentrations lead to cataracts. So diabetics have more cataracts than non-diabetics. But for all of us, a higher vitamin C may help to reduce risk of cataracts during the aging process. And then in diabetics, it seems that diabetics have a higher requirement for vitamin C than do non-diabetics, and this is because glucose tends to compete with vitamin C for entry into a lot of the cells of the body. And so if blood sugar is high, as it would be in a diabetic situation, then less vitamin C is getting in. So you need more vitamin C to be able to increase the uptake of vitamin C by the cells. And vitamin C also seems to improve the action of insulin receptors. So in the small number of clinical trials that we have so far, we see that vitamin C supplementation has improved glucose control in diabetics. So here's this 90-day study giving them 600 milligrams of magnesium and 2,000 milligrams of vitamin C each day, improving glycemic control, fasting blood sugar, and even lowering cholesterol and triglycerides to a very modest degree. Then in the lens of the eye in the diabetic, we see a daily dose of 100 to 600 milligrams a day has been shown to reduce the levels of sorbitol in diabetics. And sorbitol is a primary driver of cataract formation. And then vitamin C supplementation in diabetics has improved endothelial function, better blood flow. As you know, a lot of diabetics run into vascular disease problems. So if you can improve endothelial function and have more vasodilation and improve more blood to the peripheral circulation, hopefully there's less gangrene and peripheral neuropathy and so on. And then it also has been shown to decrease glycosylated proteins. Like hemoglobin A1C is a glycosylated protein. So a study here using 1,000 to 3,000 milligrams a day, reducing the glycosylated proteins in the blood by an average of 33% in diabetic subjects. That's a huge reduction, because those glycosylated end products of metabolism, those age proteins as they're called, the advanced glycosylated end products, form these crystals in the back of the eye. That's how one of the ways that you go blind, and then blood vessels producing inflammation in the kidneys, causing kidney damage, leading to chronic kidney failure. These are all common complications in the diabetic. So I think vitamin C has some real application in the management of diabetes. And then for male fertility, vitamin C appears to play an important role in protecting the sperm's genetic material from damage and mutations. So we know we have low sperm counts in smokers, and there's also more genetic damage in the sperm of a smoker. So vitamin C supplementation has been shown to improve sperm quality and integrity in smokers in a dose-dependent fashion. So I'm not saying it's okay to smoke as long as you take vitamin C, but I am saying if the person is a smoker, you'd like to get them to 200 to 1,000 milligrams of vitamin C if they're planning on reproducing, so that their sperm quality is intact. And even in infertile men who are non-smokers, vitamin C supplementation has been shown to increase the sperm counts by 140% within 1 week, just 1,000 milligrams a day, and that's a huge increase. And it's also been shown, to improve or reduce sperm agglutination, so that the sperm doesn't clump together and it has a better chance of fertilizing the egg. So you will from time to time have patients come in and they're looking for ways to improve their fertility if they're trying to have children, and we'll look at this in another course. But vitamin C looks like it could be part of the solution for some people. And then bed sores, people who are bedridden for long periods of time, vitamin C supplementation, lowering the frequency of bed sores and helping to enhance the healing of bed and pressure sores in a double-blind study. So that's important. And also in aerobic exercise, just so you know, you're breathing in more oxygen, you're processing more oxygen, you're generating more free radicals. Preloading with vitamin C, 500 milligrams a day, for a number of days prior, has been shown to decrease the amount of free radical biomarkers, things like breath pentane and methyl and dimelanaldehyde that's in the blood. These are indirect measures of oxidative stress in the body. So vitamin C in aerobic athletes, studies suggest, may also be helpful, and also to support their immune function. As far as vitamin C toxicity goes, vitamin C is very non-toxic unless you have some of the known contraindications or precautionary circumstances. So I want to lay these out. These are very important. If a person in the past has already had kidney stones, especially if the kidney stones are calcium oxalate stones, then what you want to know is that some of the vitamin C a person takes in, when it gets broken down itself, one of the end products that it forms is oxalic acid. And studies show that when you give people vitamin C supplements, they do tend to increase their urinary concentrations of oxalic acid. If a person is a stone former and they've had previous kidney stones, then you would at the top end, you wouldn't let this person have more than 750, maximum 1,000 milligrams of vitamin C a day. Otherwise, it's very likely going to increase the risk of a recurrence of a kidney stone, a calcium urate stone. People that have hemochromatosis, these are people who for some reason hasn't been explained perfectly yet, they just absorb too much iron. The intestinal epithelial cells allows too much iron to get absorbed into the bloodstream. When the body already has enough iron, it doesn't stop that process, which it normally would do. And so you end up with high concentrations of iron, especially in the liver, where it can do a lot of damage and lead to fibrosis and cirrhosis, and it can be life-ending. Vitamin C enhances the absorption of iron, so you don't want to give vitamin C supplements at a significant dose to somebody who has hemochromatosis. And vitamin C supplementation also increases the risk of hemolytic anemia. So we said this earlier. A person who has a glucose 6-phosphate dehydrogenase deficiency, and they can't make NADPH properly, which normally recycles glutathione. So glutathione is that tripeptide, really dependent upon the amount of cysteine that the person has will determine how much glutathione they can form. But then as glutathione goes about its business and it donates its hydrogen electron to quench a free radical, NADPH, the hydrogen of NADPH, then regenerates glutathione so it can continue in its antioxidant role. So if you don't make NADPH because you have a pentose shunt pathway defect, you don't make that enzyme, glucose 6-phosphate dehydrogenase, then you use up your glutathione very quickly, and the excess oxygen in the red blood cells, starts to damage the hemoglobin. It creates an unstable cell membrane, and then you add vitamin C, and that produces even more oxidative stress, and the red blood cell bursts, and you end up with hemolytic anemia. So those patients, no vitamin C supplementation. Also, you should know this: if you're having a stool test to look for fecal occult blood, then probably 3 to 5 days prior you shouldn't take any vitamin C supplementation, because it can create a false positive for occult blood, because vitamin C, I believe, can be a bit corrosive to the intestinal epithelial cells, and you can get a slight bit of bleeding from it. And also for people that have any significant kidney disease, I'd be very careful with high doses of vitamin C. And you see someone with end-stage kidney disease, you really want to limit it so you don't produce too much oxalic acid. And then understand that vitamin C supplementation can also cause a false positive in urinary glucose testing, because vitamin C and glucose look so similar. In many animals, vitamin C is made from glucose. So humans need vitamin C from the outside, and guinea pigs as well, but most animals can make their own vitamin C from glucose. So glucose and vitamin C have a similar chemical structure. So upon testing of the urine, sometimes it gets confusing on a lab test, where you get a false positive in urinary glucose testing, when in fact it's vitamin C that's actually showing up. So I would say prior to blood tests, fecal occult blood testing, urinary testing, I would stop taking all supplements probably 5 days prior. So on that note, we will segue next into the fat-soluble vitamins, vitamin A, D, E, and K, and then we'll move on with some other things too, including choline. So I'll be back next time. Thank you.